If you're a fan of bold and expressive art, come check out my Patreon. For just $1, you'll get exclusive access to artwork that I don't share anywhere else. Click the link in the video description to dive into my daring creations and unique artistic style. Official figures reveal a deeply concerning trend. Maternal deaths in the UK are rising, despite a simultaneous decrease in births. The data, meticulously compiled by the House of Commons Library, paints a stark picture. Between 2015 and 2017, 209 maternal deaths were recorded across England, Scotland, Wales, and Northern Ireland. This number tragically escalated to 254 between 2021 and 2023. This upward trajectory underscores the severity of the situation, mirroring recent admissions by Health Secretary Wes Streeting regarding widespread failings within NHS maternity services. Streeting himself has acknowledged a concerning normalization of maternal and infant deaths due to inadequate care. A maternal death, as defined, occurs during pregnancy or within 42 days of its conclusion, encompassing childbirth and events such as stillbirth. Liberal Democrat health spokesperson Jess Brownfuller, who commissioned the research, described the rising death toll as appalling, highlighting the devastating impact on families already grappling with unimaginable grief. Brownfuller further emphasized the tragic irony: a decrease in births alongside a simultaneous increase in maternal mortality rates. The figures reveal a disturbing increase in the death rate itself. While the 209 deaths between 2015 and 2017 represented a rate of 9.16 per 100,000 births, this climbed to 12.67 per 100,000 births between 2021 and 2023. While the 2021 to 2023 figures show a slight decrease compared to the preceding period, 275 deaths and 13.56 deaths per 100,000 maternities in 2020 to 2022, these remain the highest figures in the 8 years analyzed. This data, meticulously gathered from reports by Embrace UK, a leading authority on maternity care quality and outcomes, provides a chillingly consistent narrative. Each of the 7 three-year reports analyzed by the House of Commons Library underscores the growing crisis. The most recent data, covering 2021 to 2023, paints the most alarming picture yet. In response to this crisis, Health Secretary Streeting announced a nationwide investigation into what he termed a crisis in maternity and neonatal services. This rapid national investigation aims to provide accountability for affected families and drive urgent improvements, addressing systemic issues dating back over 15 years. The investigation will focus on up to 10 areas of particular concern, including Leeds and Sussex, working closely with families impacted by substandard care. A newly formed task force, chaired by Streeting, will oversee progress in addressing what he called the biggest patient safety challenge facing our country. Further analysis by Embrace UK reveals stark inequalities. Women aged 35 and older face a threefold increased risk of death compared to those aged 20 to 24. Black women, tragically, are more than twice as likely to die during pregnancy or shortly after compared to their white counterparts. These disparities highlight the urgent need for targeted interventions and systemic change. Recent years have witnessed multiple inquiries into maternity scandals at various NHS trusts, including Morecambe Bay, East Kent, Shrewsbury and Telford, and an ongoing inquiry in Nottingham. Despite major strategies published in 2016 and 2023 aimed at overhauling care, the alarming trend continues. Brownfuller's call for immediate action, including the implementation of recommendations from previous reports, echoes the urgency of this situation. The House of Commons Library research also highlighted regression in 11 out of 31 areas where NHS England pledged improvements in its 2023 three-year delivery plan for maternity and neonatal services. These areas include crucial aspects such as responsiveness to women's concerns during labor and birth, compassionate treatment, and adequate postnatal explanations. The Department of Health and Social Care, while acknowledging the investigation launched by Streeting, offered no comment on the rise in maternal deaths. The stark reality is this: while fewer babies are being born, more mothers are dying. This is unacceptable. The weight of this truth demands immediate and sustained action. The cost of inaction is far too high.